Hi everyone. So in today's demonstration of SonoEye, we are going to show you thoracic fascial plane blocks. I'm going to use our SonoEye P2. We have a SonoEye P2 over here. I'm going to use this one to scan the subject over here. We have a very good subject over here whom we are going to scan and show you the sonoanatomy of thoracic fascial plane blocks. So we are planning to cover 4 thoracic fascial plane blocks which are frequently used. The first one which we will be using is the PEC block, which is like the PEC 1 and PEC 2 block. We will be covering the serratus anterior plane block, okay, SAP block, and then we will be covering the posterior ESP block, erector spiny block. So before we begin, let me tell you a little bit about these blocks. So PEC block, which is divided into 2 sections, PEC major and PEC minor block. So PEC major block, which is like PEC first block, PEC 1, which is used for the anterior chest wall over here for any kind of anterior thoracic surgeries, focusing on the lateral and medial pectoral nerves. Okay, then we have the PEC 2 block, which is focusing obviously the lateral and medial pectoral nerves, but along with that it is also focusing the thoracodorsal nerves and long thoracic nerves, and along with that lateral cutaneous branches of intercostal nerves from T2 to T6. Okay, this is a kind of a block which is used majorly for anterior and lateral chest wall surgeries like mastectomy. Next we have is the SAP block, which is the focusing on majorly on the lateral chest walls, targeting the lateral cutaneous branches of intercostal nerves from T2 to T9, and again with cutaneous branches, long thoracic nerves and thoracodorsal nerves, and basically used for any surgeries which involves rib fractures. And then we have is the posterior side, not on the anterior, we have the posterior side, back side, where we are going to cover the erector spiny plane block. Erector spiny plane block has become very famous these days because of its simplicity. Okay, it is very easy and it is very effective. It covers the major components of chest. It provides analgesia to the posterior wall because we are targeting the thoracic spinal nerves. It also targets the lateral chest wall and anterior chest wall. So it becomes a very good block for any kind of open chest surgeries like thoracotomy. So now, to begin with, the scanning. Okay, so now we are right now using the SonoEye P2. We can go over here and choose the MSK preset over here. Always use enough of a gel, okay, so that you can see the structures very clearly. Okay, so I'm using the P2 transducer over here. We can see, okay, we have the orientation marker. You can always tap and see the orientation marker. So your probe position should be cranial to caudal. So when you put on probe marker towards cranial, the first window you will see, so you start from the window where you can see the infraclavicular block. Okay, so we have the window over here. We can see the axillary artery, we can see the axillary vein. Okay, sometimes you can also try to see, we can see the bony shadow from clavicle and some portion of subclavius muscle as well. Now, from top to bottom, from superficial, we can see the PEC major muscle, and if I keep scanning, we can also see the PEC minor muscle. So the shadow just below the axillary artery will be our second rib. So we can see the second rib very clearly over here. Now, once we start scanning, we see the second rib and we see the third rib as well over here, and you can see very clearly over here. Let me show you. If I freeze, I go to measure. If I try to trace it for you, this one big is the pectoralis major muscle, okay, and then we have this one is the pectoralis minor muscle, and this white bright line which you see in between, Okay, this line which is going is the interfascial plane. So PEC 1 is a hydrodissection of interfascial plane between PEC major and PEC minor. So now let's start scanning again. Let me show you a little bit of scanning over here. So now we start scanning. We're getting the axillary artery. We can see the second rib. We can see the pleura below that. We can also see the third rib. Whenever we see the third rib, we need to orient our transducer in an oblique section. So once we orient the transducer, we can still see it very clearly, the pectoralis major and minor muscle, and at that point we need to advance further towards lateral chest wall. So now when we are moving forward, we are moving from medial to lateral, we will realize that there will be a new group of muscle, there will be a new muscle originating over here, which will be the serratus anterior muscle. Okay, so over here. So now over here at this point we can see there are three planes. The first one we have is the pectoralis major, pectoralis minor and serratus anterior plane, which is just coming from the lateral side. Let me mark it down for you. Freeze it over here, measure this one, trace. Okay, so this muscle, this big muscle is our pectoralis major muscle. Over here this is the pectoralis minor muscle. Okay, and over here the third one, which is originating from here, will be your serratus anterior muscle. Do not forget to be cautious of thoracoacromial artery, sorry, over here. So now we will scan again and I will show you how thoracoacromial artery you should always try to avoid this one. Okay, so start from the clavicle. We can see clavicle again, axillary artery. Just below clavicle, below axillary artery, we will have our first, the second rib, pectoralis major, minor. We have second rib, and we have a third rib. Over there, we move a little bit towards oblique. Keep scanning, keep scanning, keep scanning. We can still see the two muscles. Good fascial plane, and at this point now we will be able to see the, just wait. Okay, you can orient your transducer a little bit. Little bit scanning over here. We can see the this is the second rib, pleura, pectoralis major, minor. Very beautifully we can figure out the fascia. We can also see the thoracodorsal artery now, thoracoacromial artery, sorry. So now if you see thoracoacromial artery very beautifully, pulsating over there. You can try to reduce a little bit of depth, and you can focus. If I break it in the middle, you see an artery pulsating, thoracoacromial artery. Now if we keep moving, keep moving, keep moving, and yeah, over here we can see three planes, third muscle coming into the picture. Right, we can see the thoracoacromial artery, which is pulsating in the middle. We can see the PEC major muscle. We can see the PEC minor muscle, and that will be the position for your PEC 1 block majorly. Okay, if I freeze it over here, so you can always try to insert the needle in plane, either from the medial side or from the lateral side. We can try to have the insertion of a needle Okay, so how the needle will look like? If we move from here, it will come, and then over here you can inject the local anesthesia to lift up the fascia and the lateral and medial pectoral nerves. Over there you will be able to visualize that. Now moving to the PEC2 block from here at the same position. Okay, we are already here at the PEC1 position where we can see the long thoracoacromial artery. If we keep moving, okay, need a little bit of gel. Reduce the depth a little bit, okay, so that we can clearly see. We can see the ribs, we can see the pectoralis major, minor, thoracoacromial artery pulsating. So now as we start traveling, maybe you can also try to abduct the arm. Okay, we'll give you a better view over here. Okay, wonderful. So now here, if you see, we can see the we can see the pectoralis major muscle. Very beautiful. We can see the pectoralis minor muscle moving. Now if I orient my transducer over here, we will see the third group of muscle, which is the serratus anterior muscle directly attached to the ribs. So over here, this is the serratus anterior muscle. If I scan a little bit, if I trace it for you, this is the serratus anterior muscle. Okay, so now let me scan it again, and PEC2 block is majorly a block of interfascial plane block hydrodissecting the PEC minor and serratus anterior muscle. Okay, so to begin with, again, just wait, keep it over here. Okay, we can see the thoracodorsal tree, we can see PEC major, PEC minor. We go down. Okay, you can still see move. We go, and then we started seeing somewhere over here is the serratus anterior muscle. Okay, so over here we have is the serratus anterior muscle, and the target for this one also is the in plane, and then go over here, either from the medial side or from the lateral side. You can insert the needle somewhere over here to hydrodissect the interfascial plane between the PEC minor and serratus anterior. Okay, so let me review it again for you. Over here we have the first one. We start with the obviously bony shadow of clavicle. We can see the axillary. We can move, and we can see the second ribs. Okay, we can see the second ribs. We can see the pectoralis major, pectoralis minor muscle, and we can also see sometimes a very good view of intercostal muscles between the ribs. We can clearly visualize. But we are focusing right now over here is on the pectoralis minor muscle. We reach the third rib. Once we reach the third rib, we tilt our transducer. We can clearly see the differentiation between PEC major and PEC minor muscle. We move a little bit. Try to orient your transducer a little bit to scan for any critical structures. Like I found the thoracoacromial artery over there. You move over here. Once you move over here, and now at this place I can see the thoracoacromial artery, PEC major muscle, PEC minor muscle, and I can see the serratus anterior coming from the lateral side. Okay, so now this is a very good plane. Over here we have PEC major. Over here we have PEC minor, and here we have serratus anterior, which is coming in between. Here we have is the thoracoacromial artery, which will be pulsating. So now for the block, PEC1 block, your needle will come from this side to over here to hydrodissect the interfascial plane over there, and then for PEC2 block it will come, I think over here. For PEC2 block it will go over here. Okay, so this was the PEC1 and PEC2 block. Okay, now moving on to the SAP block, serratus anterior block, which is targeting mostly the lateral cutaneous branches of intercostal nerve from T2 to T9, focusing on the any lateral chest wall surgeries, including rib fracture. So we can ask our patient, our subject, to take a little bit of left lateral position. Okay, a little bit. Yes, that's it. Okay, and then arm a little bit stretched over here, and then we have the orientation marker. So the exact position for this one, can you move a little bit like this? Okay, around the nippular line, if you go to the mid axillary line, around T5. Yes, wonderful. Okay, so at this position, so if we see around the nippular line, around the nipple line and the mid axillary line, you can keep your transducer. You will see the rib shadows. Okay, attached to the rib shadows will be the serratus anterior muscle. Now in SAP block we are looking for interfascial plane between serratus anterior and latissimus dorsi. Okay, and latissimus dorsi, it's a muscle which is a little bit posterior. Okay, so now while scanning, okay, you can see the probe orientation. My probe is from orientation marker towards anterior side and the posterior side. Okay, so now we start scanning. Okay, we can see the rib shadow. Very good. Attached to the rib shadow is the serratus anterior, and now we keep on scanning. You see pleura, we keep on scanning. So now from that position we will see a new muscle coming in on top of serratus anterior. You freeze, I mark it for you first so that you understand better. This one over here is the latissimus dorsi. Okay, and now focus on this portion. We have the serratus anterior. We go behind, and we see the latissimus dorsi coming in from the top. Now you see a very beautiful fascial plane between the serratus anterior and latissimus dorsi. Okay. So over here also you have sometimes cutaneous branches of thoracoacromial artery. Okay, if we go over here a little bit, okay, you might be able to see sometimes, somewhere over here we can see a little bit of pulsations in the middle. And this is the SAP block, serratus anterior plane block, which is majorly focusing on the interfascial plane between the latissimus dorsi and serratus anterior. If we go back, latissimus dorsi will be on the posterior side and serratus anterior will continue. So now you see serratus anterior is over and we are all on the latissimus dorsi is over and we are on the serratus anterior. Okay. So this is the serratus anterior plane block. Okay. So the last block which we are doing in the thoracic fascial plane block in a SonoEye live demonstration series is the ESP block, which is the closer to the spine over here. Again, providing is useful for any kind of open chest surgeries like thoracotomy. Okay, it provides it targets majorly thoracic spinal nerves, targeting the posterior thoracic region, lateral and anterior as well. Okay, so now how to scan this one? So again, we have the SonoEye transducer over here. You can see we have the orientation marker. Always use the orientation marker to realize. Place your transducer on the patient, adjust a little bit. So now in the image you might be able to see very beautiful imaging. First of all, okay, we can see the ribs, okay, and we can see the two group of muscles. One is trapezius and another one is rhomboid. Okay, so now when we are scanning for the ESP block, we need to, so my probe orientation is a longitudinal. This is over the cranial side, this is the cranial side, caudal side, the orientation marker. Now when you are scanning for ESP, okay, start from little lateral side so that you can see clearly the rib shadows, okay, and then move a little bit towards medial, towards spine, and as you move towards spine you will see a third group of muscle coming in between, okay, which will be your erector spinae muscle. Okay, we can see clearly here. Yeah. Now if you see, we have three muscle groups in the picture. We have trapezius, we have rhomboid, and we have the erector spinae muscle. Okay. Now go back. So where to use this? This is mostly used at the level of T5. So you can always try to scan from here. Okay, we can see the first, second, third, fourth, and fifth. Okay, somewhere over here. Okay, fifth. Okay, so now let me use a little bit of gel again to show you how this erector spinae SonoEye anatomy works. Let's go. So this is the level 5. Okay, you should be able to see two rib shadows. Now move in between. So now over here we can see the two muscle groups. Okay, if you can clearly make out, we have two muscles over here. Okay, the first one we have is this one over here is the trapezius. Okay, below that trapezius you have the rhomboid, this one, this thin muscle. And now when I move from lateral to medial, you will see the third muscle coming, which is the group of erector spinae muscles. So now if I move, also focus on the formation of this bony shadow. So right now this is ribs. If I move in, it will go a little flat, which means we are at a level of erector spinae. Okay, this is transverse process. Okay, and if I go, so transverse process will be a little bit more like square shape. Okay, flat, and ribs will be a little bit round or oval shape. Now if you move inside, okay, to the medial side, I'm moving medially. I can see two muscles very clearly, trapezius, rhomboid. Now if I move more inside, yes, now you see there is a third muscle which brought into picture. Yes, over here we have the trapezius muscle, and at this point you cannot see pleura very clearly. Okay, might be pleura will be a little bit clearer, but not very much. Okay, so this is, at this point we have the trapezius muscle, erector spinae muscle in the picture. If I go back, it goes away, and then again we have only two muscles here. Okay, the trapezius and rhomboid, and now again we have is the this so yeah, over here if you see, this is the So we can see clearly the transverse process, and we can see the erector spinae muscle. So erector spinae block is you provide the local anesthetic, inject either from the cranial side or from the caudal side. Okay, and the objective is to lift the fascial plane of erector spinae just above, just superficial to the transverse process. Okay, so let me just move again for the scanning. Use a little bit of gel. Okay, over here you can see, and it is very important to see the two transverse process in this window. Okay, so we can see that. So you see the ribs, you can see the trapezius, rhomboid. We move medially, and there is a third muscle which comes into the picture, which is the erector spinae. If we go more medially, a little bit medially, it will be a very thick. Okay, yeah, now you see. So now we have three muscles in the picture right now. If we reduce a little bit of length. So that is the erector spinae muscle, and the muscle, so at this point your needle will intervene from either caudal side or cranial side, and you will be focusing on the transverse process to inject just above the transverse process, so that you can lift the fascia of erector spinae easily. Okay, again just to show you, we have rib shadow. We move laterally, the rib shadow will change. We have rib shadow and two muscles, trapezius and rhomboid. We move medially. As we move medially, there will be a third group of muscles, and the rib will change its shadow and become transverse process as soon as we reach there, and that's the third muscle just on top of transverse process. Bring your orientation marker, something, bring your transducer a little bit, so that you can see two transverse process in one window, and then just on top of transverse window you can clearly you can make your intervention. You see, very good. Right? So this is the erector spinae plane block. So for such videos, follow us on various social media platforms, and if you have any requests for any other blocks or any other kind of a scanning, do let us know, and we will try to record those videos for you. Thank you so much.